Hi, my name's Sarah Lynds. I'm a clinical hospital pharmacist at Battleford Union Hospital, and I just want to take this opportunity, first of all, to thank the Health Quality Council and SMA for allowing Andrew and myself into the program. We felt lots of support from everybody, including our fellow participants, so I really appreciate that. First of all, the CQIP program, I think, has provided me with the confidence to move forward and continue quality improvement in my day-to-day work, and I think Steve mentioned too, kind of in day-to-day life even, outside of the hospital. And part of that is including interprofessional teams, and I include patient-family advocates in this as well. I was really surprised by including patient-family advocates in our conversations, the perspective they had that we hadn't even considered. And I think that moving forward in even kind of the smaller QI things that you do on a day-to-day basis, taking the opportunity to even talk to patients in hospital, in your practice, to get that perspective is really important. And always bringing it back to the patient. I think generally speaking, I always wanted to bring everything that we do in a day-to-day back to the patient, but I'm kind of an efficiency task-based person who likes to get a certain number of things done in a certain time period. And I think one of the things that the program has taught me is to just take a breath, take a second. If you don't complete all your tasks, at least do the things that you do with quality, with purpose, with the patient in mind at the end. And a general philosophy to continue analyzing change in a productive manner. So when other people outside of my team or outside of the pharmacy department come with change opportunities, to really listen to it, take a step back, and look at kind of what the deeper meaning might be to that. So my breakthrough aha moment was discovering our why statement. Honestly, it was a little bit awkward at first because I'm not used to that kind of self-reflection. But once I kind of analyzed different choices I've made in my life and my career and what that why was, it kind of provides a pillar for me to reflect on in my day-to-day, in my life, in my work. And the success for me was feeling invigorated after every workshop. I think Aisha mentioned too, like being part of a group that are so excited as you are about quality improvement, and often contacting my sponsor during, after workshops, at night before I was going to bed about, the things we had learned, the principles we'd learned, how we could affect change in our own area, and being so excited about that, and then getting back to work and having your getting back into the day-to-day and saying, I need to cut out time for quality improvement. And I think probably my number one thing that I can say is don't cut out time for quality improvement, incorporate quality improvement into your actions, everything that you're doing. And that might just be small things as well. So the challenge there was bringing back the principles you learned, sharing it with the people around you, getting them as excited as you were about it. So from an ongoing professional development point of view, I think that bringing in a wider variety of champions as well. So being two pharmacists in a completely physician program kind of led me to think we've been lucky in our area in that our pharmacists have kind of integrated ourselves into a lot of different pockets, and I think that finding champions from other disciplines as well, and including patient-family advocates, is really important. So my goals moving forward are to participate in at least one QI project in the next 12 months. Obviously more would be better, even if that's small things moving forward, and to have continued support, advocacy, and leadership from our senior leadership team. So thank you.